you're saying something important. You're saying don't focus so much on social distancing or lockdowns, for example. Put your entire focus now on increasing the vaccination drive, intensifying it, allowing more vaccine options, so that you are in a position, let's say by the end of the year, to have vaccinated a substantial proportion of your population.
Radeep, we are in a very serious situation. In the next 20 days, next 2 weeks, Bangalore will hit the peak with the institutional positivity of 24 to 25%. That is exactly how it was 1 year ago when Bangalore hit the peak. And next 2 months we will remain there at 24%. At that time, in our hospital alone, we had about 400 COVID patients. And after this peak period lasting for 2 months, we will have another 2 months of period when the COVID number will gradually come down. We are talking about fighting with this COVID for the next 4.5 months. It is not I'm not an astrologer. This is exactly what happened last year. Nothing else has changed other than the fact that we are a lot better prepared thanks to the government's intervention to fight the virus. So there is no question of wishing it away. So one of the strongest, lockdown is not an option, Radeep. Lockdown doesn't help medically. It may make everyone feel that they are doing something, but medically speaking, it will not bring down the number. The virus is in the community. Now locking down will only help them to spread it around the community.
I get your point. You're saying vaccination is the only solution. Let me see if Dr. N.K. Arora from the National COVID Task Force is there. I'm sorry our audio was lost. We are running out of time. Dr. Arora, I want to understand from you, does the government now recognize that you're going to have to increase the vaccine options and speeden up this process, sir?
See, first of all, I will pick up, I was trying to say where Dr. Devi Shetty mentioned.
Yes.
We already have about 40,000 immunization centers, and daily capacity is about 8 million. But unfortunately, we are still hovering around 3 million. So a huge capacity is underutilized or unused. And
no, so then why not, sir, with due regard, why not then expand the vaccine to all those over 20? If there is a huge capacity underutilization, let everyone over the age of 20 be vaccinated if they want to.
Yes, so it looks very attractive. So one thing which has been done, and again there is a science behind that, that from April 1st, 45-year onward will be offered the vaccine.
Right.
But I must say that 60 years plus, they are not coming because they need support, and somebody from within the family has to facilitate. It is equally important that all people, everybody who gets vaccine should get it at a center where they can be monitored for 60 minutes, 30 minutes, because anaphylaxis occurs. I must tell you that looking at the AEFIs, we must have lost 60 to 80 people if there was no observation from the AEFIs during last 6-10 weeks.
Sir, can I just said, sir, I'm sorry that I wish we could do this. We will get you back to do a longer program, but I want to ask you this.
Rajdeep, second thing about the vaccines, I am coming around to that.
The options go beyond Covaxin and Covishield.
Yes, so very soon I think we should get the Sputnik 5 has already submitted the dossier because they have finished their bridging trial. And we hope that in next couple of weeks, 2-3 weeks, we should be having this also as part of the menu available. And then fourth one is Cadila Zydus. But I must tell you, the vaccine shortage is not an issue at all. Whatever vaccine is available, I think Dr. Shetty just said he had 2,000 doses, only 600 were picked up.
So the bigger issue is, sir, I've run completely out of time, but the bigger issue is vaccine underutilization. And as you are now saying, Sputnik and Xylus Cadila will soon come into the market, and hopefully with 45 age plus, including people like me now entitled to use the vaccine, many more of us will go and get ourselves vaccinated. Dr. Shetty, Dr. Arora, thank you very much.